Hi, welcome back to our series on the long-term care home that's coming to Deep River. In this one, we're talking to Janna Hotson, CEO and President of the hospital and the health organization, and she's going to tell us about the origin story of the 96-bed home. Why is it being built here? Let's check it out. Can you just tell me a little bit about the origin story of the home?
The idea behind the home came about in 2018, 2019, when we started to look at what the availability of long-term care services was in Deep River and area, and we realized that compared to other communities like ours, we didn't have the same level and number of long-term care beds. What that really meant was that people that were waiting for long-term care often ended up waiting in hospital for a year or two or more, or they had to choose to leave the community. So what we looked at was, how could we fix this so that people could stay together, that they could be closer to home as they aged, and that they could age here in their community close to their family.
Do we currently have people in the hospital who are waiting for long-term care?
Yep, that's actually a huge challenge right now for the health system as a whole, is that we don't have enough long-term care in the province. There are a number of people in hospitals all across the province that are waiting for long-term care and don't have another destination in mind. Quite often those people have to travel a long way to get long-term care, and projects like ours are trying to rectify that so that people don't have to wait in hospital. They can move into long-term care sooner, be safer, and have quality of life instead of waiting in a hospital bed for an extended period of time.
Okay, so there's clearly a need. And I'm just wondering when the idea of a 96-bed home became a reality. Can you tell me a bit about that?
It was about 3 years after the first idea and the recognition of the need for long-term care in Deep River. And that was a result of a lot of communication, a lot of work, and really raising the profile of our community provincially. We needed to really bring attention to the fact that our community didn't have enough long-term care services. So there was a lot of work that went into really bringing attention to our community, making sure people knew what was needed here and knew that we were willing to go and make that happen. So it was 2020 when we first got approval to proceed, and what that moment was that was the realization from a provincial level that we do need long-term care here, and that it is going to make a big difference in our community, and that there's support from a provincial level for us to be able to go forward and build this.
It sounds like the organization here was the driver of this. Is that correct?
That's very much correct. The idea came from seeing what was happening in our community, seeing what was happening on the ground, seeing the people in need of long-term care, and recognizing what would be needed 10, 15, 20 years into the future. We were the ones that sought that out and really raised attention to the fact that we needed to do something for this growing community need, and we needed to really right-size our health services to fit the needs of our community into the future.
Thank you for watching. If you'd like to learn more about the home or the fundraising campaign that goes along with it, please go to drdh.org/closer to home campaign. Look out for our next video coming soon.